So I just got done editing my video here that you're about to watch. Just a warning, went a little long. It's about 10 minutes, so make the time. It's a good one. I'm a very good storyteller, and this is entertaining, in my biased opinion. Enjoy. Guess what I did last week? I went to the doctor, like the medical doctor. But Dr. Taylor, you're a chiropractor. You never go to medical doctors. No, I do. At least once a year, I go to a medical doctor. Why? To get a checkup. Make sure my body's running right. You know, they do things chiropractors don't do. They're allowed to do things chiropractors aren't allowed to do. You know, you can do blood work and stuff in office. We could do that here, but we'd have to bring somebody else in here to do it and read the panels and stuff like that. I mean, that's their expertise. The chemistry of the body. You know what else is their expertise? And the reason I went? Because they are fantastic at crisis care. So, the week prior, hurricane over in Florida, blowing all kinds of stuff over here into Texas. And it's allergy season, and I've been a lifelong asthmatic, been very well controlled with chiropractic. But I have a rescue inhaler. The week prior to me going to the medical doctor, I was feeling a little tight. Right, I wasn't able to get my lungs to expand. It didn't feel like I was breathing as deep as I could. So I got adjusted a little bit more than normal, because normally I get adjusted at least once a week. I get adjusted at least 52 times a year, bare minimum. But get adjusted a few more times than usual. Still not, feeling 100%, which is fine. We all get sick. We all face stress and things like that that'll kind of wear down our body, and our body's got to be able to bounce back. And I came to the office here. I was treating patients, and I was getting worse. My chest was getting tighter. I was producing more mucus and stuff like that. I went home. I'm having this very non-productive cough. Goes on for a long time. And I go to bed, my usual time, 9:30, 10 o'clock, something like that. And I sit up in bed at about midnight, hacking, wheezing, coughing, short of breath. I'm able to calm down, get my rescue inhaler, and I go back to sleep. About 1:30, 2 o'clock a.m., shoot up out of bed again. Same kind of thing, clutching my chest. I can't breathe. So, get my foam roller. I'm laying on the floor. I'm trying to mobilize my thoracic spine, because mobilize the thoracic spine means you can mobilize the ribs, lungs can expand better. Doing that, still short of breath. Not really breathing, starting to develop a little bit of a fever. Take my rescue inhaler again. Second time in about an hour and a half, 2 hours. Body calms down a little bit, go back to sleep. 3 o'clock, same thing. Shoot up out of bed. I'm short of breath. I'm waking up because I'm not breathing. Bust out the nebulizer. I have a nebulizer. I've had it since I was 6 or something like that. Those yearly checkups I go and get, I also, if I need some, I'll get some refills on the medication for the nebulizer. Because you never know when situations like this are going to happen. Because as great as chiropractic is, I don't know one who's open at 3 a.m. So, kind of stuck. Get the nebulizer out. Do a treatment. Go back to sleep. About 6 a.m. Same thing. Shoot up, in bed, can't breathe. So I send my office manager a text. Hey, I'm going to go to either the ER or a Care Now, urgent care, something like that. I'm going to need you to reschedule the morning. Can't treat patients if I can't breathe. I certainly don't want to be hacking on anybody. So, I'm able to go back to sleep. And I decided I don't want to go into the ER, and basically I don't want to waste anyone's time. I don't want to go into urgent care, and I don't want to take a spot from somebody who really needs it. I'm short of breath. I'm having an asthma attack that isn't going away with standard care and treatment. If somebody walks into the ER, I don't want them to have to wait because I can't breathe good, but they've got a broken limb or something. So what I'm going to do, I'm going to wait till 9 a.m. till my medical doctor's office opens up. So I go in there, I walk up to the front desk. Hi, my name's James Taylor. I'm a patient here. I don't have an appointment today, but I'm having a lot of trouble breathing and I'm very short of breath and I've developed a bit of a fever. I was wondering if I could be seen by the doctor. And the girl at the front desk goes, like I'm a burden to her. Normally we don't take walk-ins, but we did have a cancellation, so we'll be able to fit you in. Blows my mind. I am at a medical doctor's office in distress. And the girl at the front sighs because of my presence. Luckily for me, somebody canceled, so I was able to be seen. I was able to be seen a half an hour later, but able to be seen nonetheless. So I'm brought back by the physician's assistant, I assume. She takes my pulse, takes my blood pressure, checks my O2 sat. My O2 sat is 85. O2 sat is oxygen saturation of the blood. Typically, it's around 98. It's a percentage. Typically, it's around 98, 99. That's how much of your oxygen is or blood is saturated with oxygen. Mine is 85. I used to work in a nursing home when I was going through chiropractic school. And when we would check on the residents, if their O2 sat dropped below 95, we were supposed to call the medical doctor. So I physically walk into an office, my O2 sat is 85. My blood pressure is through the roof, and the PA goes, that's a little high for blood pressure, a little low for O2 sat. Turned to her like I'm sitting there like this. I turned to her, yeah, I'm in here because of shortness of breath and fatigue. We'll get you seen right away. Perfect. That's what I wanted. That's why I'm here. I'm able to see the doctor. The doctor is fantastic. Like I said, I see her once a year. She is one of the most caring individuals I've ever met. She listens to my issues. She goes over her plan of attack and how we're going to take care of this. We're going to give you an antibiotic because going through my history, actually the week prior I had signs of the flu. And we're going to give you a steroid shot. Cool. Those are both things that I would absolutely love right now. You know why? Because I'm in crisis. And I've done my conservative methods, and it hasn't pulled me out. So, guess what? I'm going to need to take another step forward. Another step down this rabbit hole of self-care, which absolutely includes crisis care, which is what medical doctors are fantastic at. So, yeah, I, James Taylor, as a chiropractor, went to a medical doctor. And I was treated, and I felt better afterwards. But what did I do first? What have I been doing the entire time? Conservative care, maintenance care, wellness care. So this was my one time every 4 or 5 years getting sick. It's going to happen. You can do all the right things over and over and over again. There's still going to be different stresses that are going to pop up in your life that your body isn't exactly used to. You know what my body's not exactly used to? A hurricane hitting Florida and blowing all this junk over into Texas and making me breathe it in. Not quite used to that. But you know what I did right after I went to the medical doctor's office? I went and got adjusted again. Because the stuff that she put into my body, I want to make sure my body works and uses it properly, uses it 100%, uses it as best as it possibly can. And the only way it's going to be able to do that is if my body's functioning properly or functioning to the best of its ability. Because obviously if it was functioning properly, I wouldn't have been in the medical doctor's office in the first place. But I was there. I had them treat me, which is what I wanted them to do. I wanted them to make me feel better. And the stuff that they gave me, I want my body to be able to use it at 100%. And there's no way it's going to be able to do that if my body is subluxated, if there's pressure on my nerves coming out of my spine, going out into my body, telling it what to do and how to do it, and how to use the stuff that's put into it and use it properly to bring my function back up to 100%. Following day, I got to adjust it again, just to make sure.